Hello everyone, my name is Fahed Bitar. I'm a cardiologist at Emanate Health and a director of the Cath Lab at Intercommunity Hospital, and I'm a part of Foothill Cardiology Medical Group. I'm glad to be with everyone today. We are on social media. During this presentation, if you have any questions, please submit them and we will collect all the questions and we will answer them at the end of the presentation. When I showed up today, I wasn't sure if I'm going to make it alive or not. I tried to put on my tie after like 9 months and I could not tie it well. I almost choked myself. And my daughter, who's 3.5 years old, looked at me and goes, "Dad, what is this you're wearing?" I'm like, "Oh, that's a tie." So I have to explain to her what it means because she hasn't seen me wearing it for almost 10 months. Today, we're going to try to accomplish 3 things. The first thing we're going to try to accomplish today is understanding a heart attack because it's the most common cause of death in the United States. So we need to understand what it means to have a heart attack and why it's an emergency to take care of it and not to sit on it and delay care, because delaying care could lead to increase of death and disability. The second thing we're going to talk about, how does the COVID affect the heart? Now, keep in mind that there's a limited literature about the effect of COVID on the heart. But we will share with you whatever we have in the literature. And the last thing we're going to end with is how does having risk factors for a heart disease or even heart disease impact the outcome of patients who develop COVID-19. And this is important because if you are one of those patients who fall in this category, you're considered a high risk and maybe you need to protect yourself more than the average person. Just remember that during the presentation, if you have any questions, please submit it online and we will answer them at the end of the presentation. The heart, when you first open the chest, it's covered with a covering called the pericardium to protect the heart and allow the heart to beat every second, every minute for the rest of your life without having to deal with friction with the other organs around it. Once you peel off the pericardium, then the first thing you will see is the arteries of the heart. It's like a plumbing system that will feed the muscle of the heart. And by trade, I'm a plumber. That means that I plug those arteries when they're plugged up. So I'm a plumber by trade. Here we go. And then below the arteries, or sometimes the arteries goes inside the muscle. The muscle is basically the myocardium. That's what makes the heart beats and pump the blood. And the simplest way to remember to understand the heart, it's a pump. It's basically a pump, and the purpose of this pump is to receive blood from the rest of the body and then send it to the lungs so it can get oxygenated. So you can get oxygen in the blood and then send it back to the left side of the heart. And then the left side of the heart will pump the blood to the rest of your body. That's in the simplest way of understanding the heart. It's basically a pump that needs to be fed with blood so it can continue to contract. And there's four valves that regulate the blood flow. 2 on the left, the tricuspid valve, the pulmonic valve, and 2 on the left, the mitral valve and the aortic valve. And then what regulates the conduction or the beating of the heart regularly is called the conducting system. And that's basically electrical system of the heart. And we have electricians that they do deal with the conduction of the heart. So this is a simplistic way of understanding the heart. So we will understand how is COVID-19 or other diseases affect the heart. This is the anatomy. Just take a look at it for a second before we move on of the heart. Now, very important to understand this slide because we'll talk about how does a heart attack presents. The most common symptoms that you as a patient will feel is a chest pain. It's a pressure, heaviness, tightness in the chest. You never had this before. You never felt this before. It can radiate to your left arm. It can radiate to your neck. And once you get it, you'll know there's something different. If you never had a chest pain and you had it the first time, I think you should always seek medical attention right away because that could be detrimental. From the time you get the heart attack, you have a window of 3 to 6 hours, which is the golden opportunity for us to save your life and save the pump. The farther you go from that time, the worse the outcome and the less effective our therapeutics will be to help you out. So just remember that. You have a chest pain, you might be having a heart attack, do not delay care. Shortness of breath is another condition. If you're something you never had before, all of a sudden start developing shortness of breath, that's something you need to pay attention for. 25% of the patients who have coronary artery disease or heart attack, they die suddenly, and we resuscitate and bring them to the hospital, and we save their lives. Passing out, feeling tired, epigastric discomfort, heartburn, arrhythmias, and AFib. These are secondary presentation, but the most important two things you need to remember: chest pain the first time, you never had it before; shortness of breath, you never had it before; sudden, call 911, do not delay the care. I'm going to skip over this slide. Atherosclerosis means quickly it's a sticky material in the arteries of the heart. It's the most common cause of coronary artery disease in our population. And as we said, it's the most common cause of death in the American population, cardiac diseases. There are two main arteries. One goes to the back of the heart, right, called the right coronary artery, and one goes to the front of the heart, called the left main, which splits into two, left anterior descending artery and circumflex artery. You'll develop a clot that will stop the blood flow to the rest of the muscle, and that muscle has no more blood flow. You need to show up right away so we can unplug this clot and open up the artery and let the blood flow. And remember, there's a window of opportunity. 6 hours, the golden opportunity. The sooner you show up, the better it is. The longer you wait, the less the benefit. After 24 hours, we might do the angiogram, we might open up the artery, but we know that basically the damage is probably already done. And the sooner you do it, the less likely you're going to have a damage to your heart, and the most likely you're going to live a normal life after that. Of course, some of the clot, like this case, does not 100% occlude the vessel. It might occlude the artery by 80, 90%. You still have some blood flow. We still have time to salvage the muscle. But again, the theme is you have a chest pain, you never had it before, you don't know what it means, do not delay care. Show up to the hospital and we'll take care of it. And let me take a minute here to divert. We do have a very good system in our hospital where we try to make sure that everybody is safe. We have places where COVID patients are not mingled, nurses are not mingling with those patients who don't have COVID. We have a seamless, hopefully a very safe process to keep everybody who does not need COVID care to be enter the hospital safely and leave the hospital safely. Just keep that in your mind. So you have a simple job when you have a heart attack. Pick up the phone, call 911. And if you can't call 911, let your family member call 911. But time is muscle. That's what we do in our profession. For the next 10 to 12 minutes, I'm going to spend talking about COVID-19 infected the heart, and then the comorbidities of the heart. How does it affect the outcome of COVID-19? When you have COVID-19, some of the things that we've seen, it's been published in the literature, you can have a myocardial injury. The easiest way to remember this is you're stressing your heart. Not necessarily having a heart attack, but the heart is working overtime. And when you do that, there's some enzyme that leaks from the heart called troponin that tells us that your heart is overworking, or the inflammation that your body is having is affecting your heart. When you have elevated in troponin, usually you have a worse outcome. 17% of the hospitalized patient will have elevated troponin. In the ICU, up to 1/3 of them will have elevated troponin. In any condition, whether it's COVID-19 infection, overwhelming infection, sepsis, dialysis patients, CHF patients, any condition that have elevated troponin in general means worse outcome. And that's the same with COVID-19. The next thing is pericarditis, which is inflammation of the covering of the heart. Myocarditis, which is inflammation of the muscle of the heart. So as you see, we're working our way from the outside of the anatomy of the heart to the inside. So it can affect the covering of the heart. It can affect the muscle of the heart. It can affect the conduction system. Your heart can beat too fast or too slow. And it can cause blood clots that can affect the plumbing of the heart or the plumbing of your rest of the body. So it can cause a stroke. It can cause blood clot in your legs or blood clots in your lungs. This is the effect of COVID and cardiovascular system. I'm going to share with you this because this is very alarming. Something that we noticed during the COVID epidemic and pandemic. Across the globe, when there's a surge in COVID-19 cases, there was actually a decline in patients showing up to the hospital with a heart attack. 50 to 70% decrease in acute emergent heart attacks at our institution across the globe. It's not only in the United States. They noticed that in Europe, and then they noticed it here, and also was noticed in China. And we don't know exactly why that is. But some of the ideas out there that people developing chest pain, they stay at home. They don't want to come to the hospital. They're scared. And as we said in the beginning of the presentation, that's a no-no. You have a heart attack, you can die from the heart attack. You need to show up so we can save your life. Another reason could be is people who develop COVID and die from COVID, they have the same risk factors that make you develop a heart attack. So those patients, if they get COVID and they die from COVID, they're not going to present with a heart attack. So that also could be an explanation. And the last one is people are staying at home, less stress, enjoying their lives, and maybe that's why they're having less heart attacks. Again, these are theories. Nobody can say that's the reason why the heart attacks decreased or that's the reason why we have less heart attacks. This is an EKG. We have 90 minutes from the time I see this EKG to open up the artery. So that's why you need to show up to the emergency room when you have a chest pain and you don't know, you never had this chest pain before, so we can save your life. This is an image of the heart. It's a still image, not moving. And if you see there is the heart, the muscle, you can see there's like two hollow pictures. And at the bottom of it, there's like, let me see here if I can work this out. At the bottom right here, you can see there's some gray area. That's basically fluid around the heart. And this is an image showing that the heart is not contracting well. The bottom part of the heart, the left ventricle, is not contracting well. You can see the valve opening and closing. That's the mitral valve, but the heart itself is not contracting. This could be an effect of overwhelming infection of the coronavirus. Now, let me spend a couple minutes talking about some of the literature that looked at patients who had COVID-19, they died, and they did an autopsy on their heart. And what they found, this is a 39-patient series was done in Germany, and they basically took a biopsy of the muscle of the heart. And when they showed that 61% of those patients who had a COVID-19 infection, and they did not have any heart manifestation, they did not have congestive heart failure, they did not have heart attack, 61% of them did show that they had some viral load, that means some detectable COVID-19 in their heart. 1/3 of those who are have detectable virus load, it was a very low number. That means may have no effect on the heart. And 16 of those patients had a very high viral load. Again, we don't think this means that the heart is weak because of that, because there was no inflammatory cells inside the muscle of the heart. Usually when you have a myocarditis, which is inflammation of the heart, you expect to see inflammatory cells inside the muscle besides the virus. Or it means that you can see the virus in the heart, but doesn't mean always that your heart is affected by that. There's another study that showed up that basically looked at 100 patients. 2/3 of them were actually at home recovering from COVID-19, and 1/3 of them were actually in the hospital. And they all recovered, they all went home. None of them have congestive heart failure symptoms, so none of them actually, the coronavirus affected their heart, and they did an MRI on them. And what they found, that the majority of those patients did have a late sequela of the COVID-19. Now, the MRI was done between 64 days to 92 days after the patient recovered from the COVID virus. And what they showed that 60% or 78% of those patients had inflammation going on in the heart. And this is independent of pre-existing conditions. So what we know so far that, yes, the virus can affect the heart. That there's nothing specific about the virus, something just only coronavirus does it for the heart. Everything that I described for you about the effect of the coronavirus on the heart has been described with other viruses causing it. Whether it's the flu virus, there's another virus called the Coxsackie virus. These are all conditions that we know about from before. And it seems like the coronavirus also causes the same manifestations. What we don't know is, number one, what is the long-term effect of this? What's the long-term effect of this coronavirus, of this inflammation on the heart? Does it take a longer time to recover and everything goes back to normal, or we can have a long-term sequela? This is an MRI showing that the top two slides are a biopsy that showed that there's inflammation in those muscles of the heart. And the bottom images showed that there is a inflammation affecting the muscle of the heart, whether the muscle or the covering of the heart, indicating that there is an inflammation in those patients who develop coronavirus. Again, don't be too alarmed, but know that there is effect on the heart, but we don't know what's the long term. As you can say, all these patients had no cardiac manifestation, meaning they didn't have congestive heart failure, they didn't have a heart attack. They just did a study to look at the side effect or what's the manifestation of coronavirus on the heart. Now, we don't have similar studies on the flu virus and how does it affect the heart, or other viruses and how does it affect the heart. This is because this is a pandemic and everybody is excited about this and wanted to know what's going on. Now we're going to switch gears to the last topic. How does the presence of cardiovascular disease impact patient risk for coronavirus infection? There's a high prevalence of risk factors in those infected with coronavirus in the general population, in the general public who develop COVID-19. And in those who get hospitalized and in the ICU, their likelihood of having a cardiovascular risk factors or disease is higher than those who don't go to the ICU. And if you have a cardiovascular disease or risk factors, your risk of dying from COVID-19 is higher. And this is very important to remember. That's why we tell all our patients who have a cardiovascular risk factors or cardiovascular disease to take extra care. Because in this study, for example, the fatality rate is 10% if you have cardiovascular disease, old MI, coronary disease, or congestive heart failure, 7.3% if you have diabetes, 6% if you have COPD, and 6% if you have high blood pressure. So the message from this that people who have coronary disease or risk factors for coronary disease are a higher risk of complications from coronavirus. And I think it's prudent for us to keep sheltering and stay away from or try to minimize our exposure to coronavirus. Doesn't mean if you have those risk factors and develop coronavirus, it's a death sentence. It means that if you develop it, you're going to be a higher risk of having complications. How do you manage those complications with coronavirus? Basically, there's no specific treatment for coronavirus and effect on the heart. We treat it like anything else. If you have pericarditis, we give you NSAIDs and colchicine. If you have myocarditis with congestive heart failure, we give you some steroids, CHF medications. We can give you some medication to increase your blood pressure, some special devices that we can give to help your heart. And if you don't recover, we can send you to transplant. AFib, medication for the AFib, we control the rate, we give you blood thinners. And if you have a blood clot, we give you also blood thinners. Let me summarize what I talked about by this last slide. Again, if you have risk factors for coronary disease, or you have coronary disease, which is your older age, if you have comorbidities such as cardiovascular disease, lung problem, kidney problem, diabetes, if you have inflammation, if you have some high risk for your blood being thick and developing blood clots, you are a higher risk when you develop COVID-19 to have worse outcome. And if you develop COVID-19, then your heart might be also affected by it, whether you can develop pericarditis, whether you can develop myocarditis, blood clots, congestive heart failure. With this, I will end my presentation, and I'll be more than happy to answer any of your questions at this time. Okay, the first question here. Can you explain the clotting risk and danger we have heard for COVID? Is this a serious concern that can be addressed by specific treatments? Very good question. Very good question. Yes. When you come into the hospital and you have COVID-19 and you're admitted to the hospital, there are a series of blood tests, something called ferritin, D-dimer, and CRP. If those are elevated, that means you're at risk of developing blood clots, and therefore they put you on blood thinners. And there are different blood thinners that we use, from heparin, Lovenox, Xarelto, Eliquis. These are the most common used blood thinners. So the answer is yes. We have a way to see which patients are at higher risk by looking at those markers in the blood. And then if they're elevated, we'll give you a blood thinner to protect you from a future blood clot going to your brain, giving a stroke, or to your lungs, or in the legs, or even to your heart. Very good question. Does having high blood pressure put you at a higher risk for heart attack or COVID-19? The answer is yes, yes. As I shared with you here in this slide, that if you have COVID-19 and you have high blood pressure, your risk is a little bit higher than those who don't have high blood pressure. And yes, high blood pressure is one of the risk factors for developing a heart attack. And the theme is this, that the same risk factors that predispose you to a heart attack or blocked arteries in the heart will predispose you to worse outcome when you get COVID-19. So you should, protect yourself as much as you can. Everybody should protect themselves. I'm not trying to say that nobody should protect themselves, but those who have higher risk features, they need to take extra care than the average person. Good question. Next question. What can I do to lessen my risk of heart disease? Very good question. I can spend the rest of the day answering that. It's a twofold approach. One thing is, if you have risk factors for heart disease, to control these risk factors. Take them seriously. If you have a high blood pressure, make sure you see your doctor. Make sure your blood pressure is controlled. If you have a high cholesterol, make sure you control your cholesterol. Make sure you're under control. If you have diabetes, very important to make sure your diabetes is under control. So these are things that we can do for you by visiting the doctor and making sure you follow up with them, because they can give you medications or change your lifestyle to manage those risk factors. The other part of it is your responsibility, everyone's responsibility, to make sure that they exercise, they eat healthy, they diet. The recommendation is 150 minutes to 210 minutes a week of exercise. Moderate intensity exercise will protect the heart. You don't have to be a runner. You don't have to do extreme kind of exercise. Believe it or not, just moderate intensity exercise for 150 minutes to 210 minutes a week is more than enough to protect your heart. Watch your weight. Don't gain weight. Try not to gain weight. Eat healthy. More fruits and vegetables. Less and less sugars and carbohydrates. Protein diet, balanced diet is what's recommended. So it's a twofold approach. One has to do with addressing your risk factors, and the other part, making sure that you do what's right for yourself by exercising, dieting, and doing the right thing for yourself. Basically, we call it a balanced life. Next question. Can COVID weaken the valves of the heart? No. So far, we have not seen any direct effect of COVID and the valves. Now, if you develop myocarditis and your heart dilates and enlarges, then yes, the valve might not close and you can have a leaky valve. But just isolated leaky valve of the heart with a normal functioning heart have not been described yet, or I did not encounter that. Maybe it's out there, but I have not encountered that yet. Let me go back to this slide here. I think I overlooked it. All right. This is the slight anatomy of the heart. The valves of the heart have not been affected yet. We don't have any literature says that it can only affect the valves of the heart. As I said, there are conditions where you can have a myocarditis where the heart dilates and the valve doesn't close well, but that's an indirect malfunction of the valve because the muscle of the heart is not functioning. It's not because the valve itself is not functioning. But every other part of the component of the heart is affected. Yes. But a very good question. Next is, how often should I see my doctor if I have diabetes? You have to, it depends whether your diabetes is well controlled or not. And this is, I don't treat diabetes that frequently, so I'm not the right person to answer that question. But there is a simple theme in medical care. If your risk factors are controlled, once every 6 months or once a year is enough. If your risk factors are not controlled and your doctor is working on them, then you'll require more frequent visits, maybe every couple of months, 3 months, depending on how well your risk factors are controlled. So I would refer you back to your primary doctor or to your endocrinologist who's managing your diabetes. They're probably better equipped to answer that question. But the general rule, if the risk factors are controlled, you don't need to see us as frequently. If your risk factors are not controlled, then you need to see us more frequently to get your diabetes or other risk factors under control. Very good question. Okay, I guess these are your questions. They're excellent questions. Again, thank you for joining us on social media. It was great to address and talk to all of you guys. Hopefully we can do this more often, and stay safe. And if you have chest pain and you know what it is, do not delay care. And I'll leave you with this. Time is muscle. All right? We'll talk to you guys soon.
As COVID-19 spread during the past few months, you were told home is the safest place. While you were at home, we were here, caring for patients and working around the clock to make Emanate Health a place you feel safe coming back to for all your healthcare needs. Our top priority remains to provide quality healthcare services in a safe, compassionate environment to our communities in the San Gabriel Valley. So here are 3 things you need to know. We are open. We are safe. We are clean. We are now offering a full range of elective surgeries at our hospitals and facilities. We are also taking appointments at our outpatient services. For non-emergency health needs, our ER check-in tool is also available for patients visiting our emergency rooms. Please don't delay the care you need. Call your doctor to make sure this is the right time to schedule a procedure or appointment. If you don't have a physician, use our Find a Doctor tool on emanatehealth.org. Emanate Health goes to great lengths to protect every single patient and staff member. These safety protocols are in place across our healthcare system. Everyone who comes to Emanate Health is required to wear a mask and is temperature screened. All patients scheduled for an elective surgery are tested for COVID-19. For pregnant patients who have a scheduled induction or C-section at our freestanding Family Birth and Newborn Center, testing for COVID-19 is administered prior to their due date. Our waiting areas, including those in our emergency rooms, have seating placed 6 feet apart to enforce social distancing. All suspect coronavirus patients who come to the ER are placed in a separate area while they wait for further care. Our admitted COVID-19 patients are placed in isolation units on a different floor from everyone else. We are limiting guests from visiting our hospitals and limiting access to hospital entrances to keep everyone safe. We have implemented tough antivirus cleaning practices to protect the health and wellness of everyone. These cleaning protocols include disinfecting our hospital rooms with an electrostatic sprayer. The fine mist penetrates hard-to-reach places and kills viruses in 30 seconds. Using state-of-the-art air purifiers and moonbeam UV lights to neutralize pathogens like COVID-19 for high-risk patient rooms. Wiping down counters, handrails, doorknobs, and other high-touch surfaces multiple times a day with EPA-approved disinfecting wipes that kills viruses within a minute. Installing more hand sanitizer stations at points of entry to our facilities, and providing surgical masks for all patients and staff who need them. Safety is part of our mission at Emanate Health. We're doing whatever it takes to make sure you feel safe to get the care you need when you need it. Our doctors, nurses, and healthcare staff are here to provide emergency, primary, and specialty care for you, our communities in the San Gabriel Valley. Thank you for always trusting us with your care. Welcome back to Emanate Health.